we launched Prana AI, which is all about measuring your wellness score, scientific, data-driven, because hospitals have got the traction they've got because they're evidence-based. They're measuring your temperature, 98.3. Now you're at 100.2, so you're unwell. We don't have that wellness. We need to. We don't have a paracetamol given to anybody just because you've got a fever or you've got a cold or you've got a cough, you get a paracetamol. That's not right for you. We're getting addicted to medicines. We don't need to. We can easily solve it with natural immunity. So that is where Prana Wellness was born, Prana AI was born, and we're trying to use data. We're trying to use AI to further improve your interventions because nature has gifted us with a lot of immunity. You're just not leveraging enough. Nobody tells you, no doctors tell you that you should be walking 20 minutes after your meals, in let's say after lunch or dinner. Your sugar levels will never go up.
Good afternoon to one and all, and welcome to today's fireside chat with Mr. Sumit Puri. With an incredible 28 years of work experience in the corporate world, spanning across industries such as insurance, healthcare, and technology, he has been at the forefront of driving transformation and innovation. An alumnus of prestigious IIM Bangalore, Mr. Puri is also the founder of Prana Wellness, a groundbreaking platform that leverages technology to redefine wellness in the corporate world. His journey from being a corporate leader to visionary entrepreneur is nothing short of remarkable. Beyond his professional accolades, he is known for being an amazing human being, bringing thoughtfulness and empathy to everything he does. On behalf of Master Union, Mr. Sumit Puri, welcome to today's fireside chat. Let's get into the conversation here.
Thank you. So, repetition increases memory, so it's good. Thank you.
Most people that you see in the auditorium today were not even born when you started your professional career. So let's dial back to that old time, from working at Maruti to pursuing your MBA to starting a completely new career trajectory. What was going on in your life at that time? What was the thought process like?
Sure. So, thank you for making me feel old. It really best. But really, I think it's basically not to me. No, I go back in time, and I basically finished my engineering. I've been to a Maruti, and I was actually one of the guys who was really enjoying the time that I was spending there. But I always had this ambition of getting an MBA done. And I just kind of mentioned that the biggest learning I would just take from the experience of going from Maruti to IIM Bangalore, and then of course to corporate life, in PwC, was the importance of mentors. You need to have some mentors. So I was, because my father was in the police and I've traveled some 9 states and changed 9 schools, I was quite adaptable, learning different cultures. I was actually quite, I would say pretty open to change. But I was stuck in a corporate job in Maruti for 6 days a week. And I was always talking amongst my friends that I would like to do management. I'd like to do an MBA. And this IG police was hearing me. He loved to talk to young people, and he kind of called me aside after a few, such overheard conversation and said, "What do you want? You want to do an MBA?" I said, "Yeah." "So what are you doing about it?" That hit me literally. He said, "You actually, need to plan because you now are in, say, August. The CAT happens in 2 months' time. You better start studying for it." I said, "I have 6-day job." He said, "Boss, start working towards it. Come back from office, spend 2 hours just studying." And that was to me such a good advice. And I managed to then get into CAT with 2 months of preparation. I was lucky. And of course, then the journey started and got into, after that to PwC. But to me, the importance of mentors, to get the right advice at the right time, is so important because we have some goals, but we don't put them down. We don't measure that very well, saying, what do you want to do to achieve that goal? So that to me was the start of the corporate career, which to me was quite transformational.
That is true, though. So finding the right mentor, I think in today's world has been a skill I think all of us are right now honing up to. But sir, right after I think IIM Bangalore, you had an amazing stint at PwC and then later at G Capital as the digitization leader. How was this industry at the time? I think because at the time, digitization was fairly new and the adoption would be challenging. How was the process taking along there? Were there your opportunities that you had?
So frankly, I think, it was the early days. So PwC exposed me to different industry sectors. So I had a good perspective. I was working with, the CAC Calcutta's and the Hughes software system. So you had a good sense, of the old and the new, in a way. So when I got into G, digital transformation was just beginning to gain root. It was just the start. So we were in some ways the early pioneers. And I realized that it's an open field. It's a blue ocean, literally. And I was very, very enthused because G, really was in a way a training ground. It loved company interactions. It loved cross-functional, collaborations. And it was doing Six Sigma, and leading many such initiatives. So I kind of, really thrived on it. I got a lot of initiatives started. We did same time, which is today's WhatsApp, collaboration across countries. I was doing Hungary, Mexico, China, US, and India, collaboration there. We did, rollout of CRM system. We did rollout of global purchasing systems. So multiple initiatives. To me, the biggest plus point was to see the power of digital transformation actually showing results in the corporate results across countries. And we minimized duplication, we enhanced productivity, we enhanced revenues. And to me, we've seen the story after that, how it's unfolded, how digital transformation becomes so much more important across. But we could see that at work, in early stages. And I think I was fortunate, to get that exposure.
Interesting. And had there been so most of the time, at least the companies with a good budget at the time would be definitely jumping on the opportunity to digitize, get more and more output out. But had there been a time you had to withdraw from a certain project? Were there any learnings about that particular sector or the client itself?
No, absolutely. So I'll just give you an example. So we did multiple projects, and I've done hundreds of projects, successful projects, enterprise-wide, multiple countries. But early learnings, So I had this project called the GIS project, which was basically we had in and it used to be called G Gaon, by the way. Gurgaon used to be G Gaon because we had 5,000 people in G, here frequenting all the restaurants. That's why all the restaurants came up in the beginning. And talking about 2000, 2005. With that, we did a project called GIS where we had, the employees were supposed to go on shifts back to their homes, right? So they had contact center operations, and I could see the opportunity to automate shift, of these employees, the transport shifts, because we had colossus and sumos going and transporting them. One person going to a CP, one person going to Noida, one person going to, let's say, Vasant Vihar. We could easily optimize, say, 5 people in one colossus. You don't need to have one person in each vehicle. So we started this project, and I was very, very confident. I said 35 crores we spent on GIS. Can I basically reduce this by easily 20, 25, 30% on the transport cost by just optimizing? The learning I got there was you have to have a very good amalgamation of people, process, and technology. The people who are running those manual shifts, I never took them in confidence. I never told them this is what technology will do for you, and you don't have to be worried about your jobs. Because Google Maps was not what it used to be today. Google Maps was probably 95%, 97% accurate at that time. And we went ahead and deployed this. And we knew we could easily save a lot of money by putting these routes together. But those people who were running shifts, 20, 25 people, they said we're going to lose our jobs when this automation comes in. And they deliberately failed it. They actually did not make us succeed because they said this route is wrong. And I couldn't dispute it because there were certain maps that were incorrect, completely. So to me, if we had worked closely with them in partnership, I would have easily saved some 10 crores every year, maybe grown much more. But that was a lesson. Work with people, get them to be open to changes, show them that this is something you could probably do going forward. This is the value-added job you'll do. You don't have to just run roads. You can probably do a much better job. We are only using hands. We're not using minds. We're not using hearts of people in our corporate workplaces. We could have done better. That was a great learning, and I've benefited from it over the years. That's how we did all those hundreds of successful projects later.
That is interesting. I think that's one insight for all of us, especially when we talk about AI at the time or so. We have to consider people from day one, especially if they have to transform or at least upskill to still be part of the workforce today. This is very, digitization at this scale is very interesting. But eventually, I think you also transitioned into an insurance role at ICICI Prudential. What happened at the time? Was there a strategic move, or there was an affinity towards this role already?
So it was an affinity towards my CIO and CHRO because GE had decided they were in the financial services boom. 2005, everybody was, getting a lot of money. We had Goldman Sachs and everybody else, all the big names were, doing very well. Lehman Brothers. And they decided to withdraw stakes from India. Genpact was not Genpact at that time. It was GE Capital International Services, which is what I was leading as the global digitization leader. So nobody knew what's going to happen with GE withdrawing its stake. It was, pretty much a baby out of the bathtub. So we kind of moved, to ICICI Prudential because my CIO and my CHRO said, please join us in ICICI Pru in Mumbai as senior vice president. And I followed them. I was saying, look, they have confidence in me, and that's how the journey in insurance started. Genpact did very well, by the way, but just that we didn't know that at the time. And I was keen to work with known people and explore new horizons. And insurance was an interesting field. We were 1 million policies that time, and we grew to 8 million policies in 4 years. So it was something which was a challenge, and we loved it. The new opportunities, new challenges that came up that time.
Interesting. I'll again take a moment to highlight, again, the mentor element comes so much into play, especially when there's external threat in the industry. That is a very good thing to have, especially if your bosses or ex-mentors still want to work with you and push you forward. That is very, very interesting. But sir, I think while working in ICICI Prudential, you were again eventually led to lead a charge in an abroad office as well, that is in Indonesia.
That's right.
How was that? Did you find it challenging since you lived most of your life in India?
So I mean, like I said, I studied in 9 schools, different. India is a country within, got so many countries within India itself, so different states. So I was quite adaptable. When I moved to Indonesia, I told my CIO, and this is a group CIO from Prudential who liked me when we saw those interactions in the regional conferences. I didn't know much about Indonesia. And this is like 17,500 islands. It's an amazing place. But nobody knows much, about some of those countries unless you go there. I told them I don't want to spend more than 2 years there because you already had reached a particular point of career where you said, look, I mean, I'd like to get exposure outside. I've done good success here, but let me try out world markets. So I said 2 years is what I will spend there. Then maybe put me in Singapore or Hong Kong or any of these countries. But I loved the place. I loved the energy. We grew. We were actually at category C countries in Indonesia because they were not capitalizing on opportunities that were in front of them. We had regulations changing, and they were very laid back people. And I in a way, created this high performance teams with using available resources and maybe a combination of some external hires. And we became number 1 in Asia. We became 37% of Asia profits, 10% of global profits. So to me, it was a very interesting kind of exposure. I found the good thing about Indonesia was that they respected Indians, because all of us need to realize that there are priorities in life. You want not just money, you also want respect. You also want sometimes the right kind of fulfillment in terms of your jobs. And I found all that there. And we also made the company grow. So to me, that was incredible. And then, of course, I did get a chance to also work in Singapore and fulfill my dreams of, having a regional role. But I think you should grab opportunities. Be open to change. Be open to new things. That's what I learned, with that exposure.
That is interesting. And even Masters Union right now, we have a lot of international placements coming in. We have a lot of candidates in the room as well who are planning or still figuring out whether they want to work in the world markets as well. Is there any insight that you want to share with us when you come back or you work there? Like, does it give a competitive edge to you? Does it open up your mind?
So I'll tell you what. So I can just give you a quick sense. Look, we had there was a project done in Indonesia called Operation Goes English, which I was asked to lead. I was a CIO there, but they said, you lead this Operation Goes English. They had 1,000 employees in operations or 800 employees in operations. I said, okay, great. And typically Indian style. What I did was I said, okay, fine. We have 800 people. I'll put 80 people as the best amongst them. I'll make them the leaders. And I will run a program, I'll run a training program for them to improve their English skills. Because, operation needs to connect sometimes to international customers, etc. So we ran that, and then I announced rewards. Again, India style. The best facilitator gets 5,000 rupees or whatever. I'm saying that time it was 1 million dirham, 1 million rupiah. So I'll give you that. It bombed spectacularly, because I did not realize that this culture valued teamwork, whereas we celebrate individual success. They were very much a team-based culture. And I changed track. After 3 months, I pivoted. And I said, I'm not going to do any individual rewards. I'm going to do team rewards. And that completely changed the entire success of the program. Everybody contributed to helping each other. And we did team dinners. We had a award for the entire team, which did the best. It was amazing support, amazing collaboration. So to me, it's about open to cultures, open to understanding what works. And sometimes we are too self-oriented, which is not very helpful in corporates. So I learned this, from that culture, and I embraced it. Because teamwork, you can't beat it.
And I think for an entrepreneur, it's one of the most important skills to have multiple perspectives on a project. Speaking of which, like after working for nearly 28 years, what was the pivotal time when you decided to start your own venture? Was it planned all the way, or did something happen along that?
COVID happened. COVID happened. And of course, before COVID, I had come back to India because of my dad. So I was doing well in Prudential and all of that. But I came back to India because he had kidney failure. So I came back without a job. And this is a question of values, right? All of us have some values and principles in life. And I was thinking my brother is going away. He was getting a great opportunity in Dubai. And I was also away. And I said, look, this is not what our parents brought us up for. So I came back and I fortunately got this opportunity where, my friends, from G and others said, this is a role, available for you. And I got the CIO position in Max Hospitals. And my father was in the police. So, he actually had commanded some 35,000 people, at one point of time. But after retirement, he was finding it difficult to even get a dialysis slot in hospitals. Hospitals are not the easiest of places, as many of us understand. So he was finding it difficult to get a slot, sometimes 6 in the morning. And this is a 4-hour dialysis, typically which happens where your entire blood circulation has to change. And then 8 in the night, you don't even get drivers in Gurgaon all the time, sometimes to come back at 12 in the night. So for the first time, I saw him cry. I said, look, this is not what I should be, doing here. So I came back and I got a job in Max Hospitals purely by divine intervention. I came here, somebody said, this is a job opportunity open for you. I already had declined Max Life Insurance. They said, why don't you join Max Healthcare? And then I got in touch with doctors. I knew doctors through Max Hospitals. And I got the slots for my dad. 11 to 3, every Monday, Wednesday, Friday. And it was great, superb. So Max Hospitals happened by chance. And I realized this is the sector I wanted to be in. Because healthcare today is sick care. We're not actually improving health. We are just taking care of acute sick people. And I wanted to make a difference. So Prana Wellness with my dad, that was the start point. And then with COVID, then I realized I lost a lot of people, some very close friends at a young age. I said I should probably do something about it. And I was nearing my second innings. And I thought, why not do AI-based wellness? So that's how Prana Wellness happened.
Interesting. And that actually gave you so much exposure towards the current healthcare state of India as well. At the time, did you see any other gaping opportunities? So at the time, as you said, that we were only solving for acute illnesses that were there. What is the state of preventive wellness in our country?
It's not there. Hardly there. So I must say that, today, if I look at chronic lifestyle issues, we have 1 in 2 people in the world having a chronic lifestyle issue. It was 1 in a million 100 years ago. It was 1 in 400 in 1940, 1 in 50, 1970, 1 in 20, 2000. Imagine the way it's growing. 1 in 2 people now today have a chronic lifestyle issue. And half of them don't even know they have a chronic lifestyle issue. So you could have a hypertension, you could have stress, you could have, of course, kidney problems or diabetes or, cancer, all kind of problems stemming from your lifestyle, stemming from your metabolic health. So to me, I think prevention is the answer. Because you have a window of 20 to 30 years, especially at your age. You can really make a big, big difference by changing your lifestyle. So to me, it was about recognizing the early warning signals and addressing them through exercise, sleep, nutrition, and stress. Of course, environmentals. We can't do much about the environment. The pollution that you see in Delhi, you can't do much. But the corporates can do something. And that's why I'm saying corporate wellness. I'm actually saying I could measure each of these dimensions. And we will create communities by which people can work together to improve their score in each dimension. So for me, it was an opportunity to, in a way, focus on prevention in a scientific, data-driven, outcome-oriented manner. And that's what we did. We launched Prana AI, which is all about measuring your wellness score, scientific, data-driven, because hospitals have got the traction they've got because they're evidence-based. They're measuring your temperature, 98.3. Now you're at 100.2, so you are unwell.
Right.
We don't have that wellness. We need to. We don't have a paracetamol given to anybody just because you got a fever or you got a cold, or you got a cough, you get a paracetamol. That's not right for you. We are getting addicted to medicines. We don't need to. We can easily solve it with natural immunity. So that is where Prana Wellness was born, Prana AI was born. And we're trying to use data. We're trying to use AI to further improve your interventions because nature has gifted us with a lot of immunity. You're just not leveraging it enough. Nobody tells you, no doctors tell you that you should be walking 20 minutes after your meals, let's say after lunch or dinner. Your sugar levels will never go up. Nobody tells you because the average age of doctors today is 61 to 63 years in India. Average age of Indians is 70 plus. So doctors don't know about lifestyle. Unfortunately, they've not been taught. I'm not blaming anybody, but they're not being taught about lifestyle. Nobody knows. So we are saying, can I measure this? Can I make it really a part of what you do with the support of a community? So young people, if they basically support each other, we had a support system when we were growing up. Today we don't. We have social media, which is cause of stress, unfortunately. How do you really start solving this with the support of community and with a more data-oriented approach? That's what we are doing. We are basically using AI to also give you AI-based exercises, wellness in your pocket, making that available. That's the objective.
That is very interesting, though, because when we speak about wellness, especially in the preventive side, it's very qualitative in nature. So how do you measure, like, especially when you're delivering to any corporate clients, how do you measure that your solutions are delivering some expected results out of them?
Great. So I won't take the name, but I am working with a very large private hospital here where we are comparing the score I'm giving versus the score they are giving with blood pressure machines and all, because I have a 1-minute facial scan which measures 11 parameters. So our objective here is to start measuring this in a much more scientific way. And we are keen to look at this in a way that that hospitals compare their clinical parameters with what we are measuring. So when you give this 1-minute facial scan, we top it up with some lifestyle questions. So my level 2 is a score that gives you a very good indicator of activity, sleep, stress, and of course your environment. And then you know which area to work on. And when we compare the dimension, when we compare the actual parameters with clinical parameters, you will see they're compared very favorably. So we've got now hospitals saying, let's use this for my OPD. I don't need my nurses to take the vitals. You could just take this on a mobile. Just travel with it anywhere you go. So you know where you are at any point of time. So to me, this is where we are kind of trying to disrupt healthcare, because healthcare today is, as I was saying, is sick care. And you need a continuity of care. That is the part we are trying to drive.
That's interesting. And all of this is done through facial scan?
Yes. It's basically, it uses a revolutionary technology called RPPG. It's photoplasmography, which is about measuring a blood flow. And with that, they tell you very, very accurate indicators of clinical parameters. And we're going to measure before and after. So 6 months before, where were you? And 6 months after, where were you? And I think I'm actually talking about parameters that are actually important to you. Because today, unfortunately, we look at weight as one of the biggest factors. Weight is not a good indicator of health. So I'm just saying we measure things that are actually important. That's what we're kind of showing you. And before and after will show you that there is a difference. And you will not have those heart attacks anymore. You will not have those kidney failures anymore, because you are going to be focusing on prevention. So you can lead a very, very healthy life. I'm talking about health span here. I'm not talking about lifespan.
Healthspan, I think, we should ideally optimize for healthspan, and lifespan is something still not very quantifiable at the time. So if possible, could you give us a quick bird's eye view of the business model you have set up at Prana Wellness, and what does a typical customer look like when they reach out to you? What is their expectation out of this entire offering?
So our business model is actually B2B2C in some sense, but we're also encouraging customers to join, from the App Store. Within a week, we're already running pilots in UAE and India, and hopefully Saudi also, December. But our basic objective is to give a score to users. And, they just come onto the app and they will run challenges. So I'm saying 10,000 step challenge. No added sugar challenge. Anybody and everybody, global communities. Let's try and make this a movement. Let's make it useful. In Dubai, we have a number fitness challenge, which means everybody needs to do 30 minutes exercise every day, at least 30 minutes. Now, that's a great way to get connected, to a global community. So we're saying, let's start the movement. Let's get more people connected, and we can run challenges. Each corporate can run challenge. And of course, we have a global challenge as well. So that's for general users. For us, as a business model, we are basically saying corporate subscriptions, which basically means I'm going to give you a very nominal cost to giving you a score and giving you, the AI-based exercise and AI-based nutrition modules. And we run this. If you have a low score, we will have our integrated functional medicine doctors telling you this is what you should improve. And then we have psychologists to help. So objective is you can take our platform, our modules, or just do it the way you want to. I am focusing only on the score. With that score, this is the area I should improve. So that's where we are kind of coming for. And our main objective here is to give corporates this dashboard, which shows these many people were pre-diabetic on average. These many people were, let's say, diabetic or had a cardiac risk. We have the scores for showing the percentage. And this is what has happened 6 months later. So the claims will reduce, because I can tell you, our biggest challenge today is that we are not exercising enough. We're not in some ways. We are exercising less, we are eating more, we are sleeping less, we are stressing more. All of these are wrong. This is where simple hacks can help you. So our objective is to really make this much more easier to follow with support of community. So the business model is corporate subscriptions, get them on board. If a user needs it, then the user basically can subscribe for a gut cleanse challenge or a diabetes management challenge, or, and these are all functional medicine doctors who have 98, 99% reversible success stories. They've done it over and over. It's just that they never put the data out there. So nobody knows that this is successful. We all, the moment we hear wellness, we say it's hogwash. We are saying, I'm going to show you data. It shows all these people can reverse diabetes type 2. All these people can reverse, let's say, cardiac risk, make it much more easier to live a very healthy, normal life. So that data is what we will hope to put out there for insurance companies to come on board. Because for me, I worked 10 years in insurance. Our ultimate goal is to get insurance companies to support this so that the customer doesn't have to pay anything. You simply get insurance to say, I'm going to take this up because prevention takes only 2% of cost versus 98% of healthcare cost.
Right.
So we're going to get health insurance companies on board.
That is interesting. And especially, so given the outcome, it clearly is a very, very mega successful offering that is there for the B2B clients. But why only cater to businesses? Why not cater to individuals like most of us? I personally like sitting here. I was curious why I'm not ever exposed to a model like this. Was going business only a strategic decision, or B2C is on the way?
So look, B2C will come when you have funding. I'm a bootstrap guy. I'm spending my own money on this. And of course, we have limited budgets and we're trying to make sure that we can do this well. But yeah, objective is to ultimately reach out to customers, to users, and we want it to be B2C. But the marketing costs are phenomenal. We don't want to spend as much right now. That's why B2B2C, we get enough data to come in. We are partnering with hospitals. We are partnering with insurance brokers and TPAs. And hopefully at some point, we'll go to insurance companies in 6 months' time, 12 months' time, where they will support. Because we know this is so proven. It's just that nobody's collecting data for this. So long story short, for me, it's all about the money. How much money can I spend by myself? And if I can probably get some support, then I'm sure we can do a very good job at B2C marketing.
Right. And I think one of the secret sauce of this entire offering is the AI that you use. Could you give us any example of a specific tool or any specific feature which uses AI, in which manner, and how is it delivered to the client at the end of the day?
Sure. So I'll basically just say that we actually have this AI-based exercises, which if you've got a low score on exercise, now you have an exercise routine for you, which basically means you could have, say, on week 1, you have 5 routines. And we are giving you a goal saying you should do at least 150 minutes of, say, of walking, running, exercising, whatever. That is the target for yourself. And, we measure this with the AI-based module. So when you're exercising, you put your mobile phone in front of the wall and it will tell you when there's something wrong. Alexa, it will tell you when you're doing something wrong. And you can also have your trainer actually look at the metrics, the dashboard, and tell you, this is where you should improve. What we're doing is we're optimizing the time of the trainer and you're optimizing your cost, because you can't spend too much money on fitness firsts and all those gyms. And, sometimes you're too tired to go and dress up for a gym. You look at New Year coming, right? Now, New Year resolutions, all of us, first few days, you all run to the gym. And after a week, you're all flagging. Momentum come down. Imagine you had the gym in your pocket, using it as you want to. And of course, you can go to the gym whenever you want to, but you actually have a gym in your pocket whenever you want to. And you're having 600 to 700 routines on that app. And when you're doing something wrong, it is telling you when your, posture is wrong, or you basically are not putting your arms, spread out right. And beyond this, you can probably take a consult with the fitness trainer once a month. So your cost comes down. You have the AI-based exercises, and that becomes so powerful because this you can sustain over a longer period. And let's say you have an accountability buddy. You do this together in a community. You will see amazing results. That's what I'd say.
Amazing. And how many geographies right now would Prana Wellness be spread in?
Bootstrapped. So India and UAE. UAE was the one we did pilots, and India is where we are starting now, because India is the land of opportunity. I wanted to make this big in India and then go out to other geographies. I'm very keen to kind of really start enrolling, students, corporates, interns, people to come in and probably join this, because it is a crying need. Healthcare is a sector ripe for disruption. And I think any of us who actually have the right kind of attitude and the right kind of, I would say, open-mindedness, they could make a huge difference. And I'm more of a guide and a mentor. I'm not somebody who would like to basically be the flag bearer of this. I want young people to take charge. They are the ones who will lead this. So for me, you will have the platform. You will need fresh ideas, fresh thoughts to make this a movement. That's what the objective is.
That is gold, actually. And for at least the young minds that we see here, you are the front runner in at least healthcare and AI being married together. We have generative AI and genome technology also coming up very strong. What are your thoughts in the future of this on how healthcare will be delivered maybe half a decade from now?
So look, AI, genomics, precision medicine, this is the future. I can't say, that when it will come for sure completely to, the masses, but it is the future. More data we get, the better we will become, at precision medicine, at genomics and all of that. For me, we are basically looking at democratizing this to the masses. But I also have level 4. I talked about blood tests, which is basically level 2 is the lifestyle question, then blood tests, which actually will measure the actual scores and tell you exactly where the risk is high. But our level 4 is genomics. This is for maybe the CXOs and the CEOs and the entrepreneurs who probably can afford it. But if I have the genomic test, you have something called gene type, a genotype that kind of expresses itself. If you use the pillars we are putting, the exercise, nutrition, sleep, stress management, you will not have these genes express themselves. So you can stop these genes from expressing themselves, which means you can live a very healthy life for many, many years, 80, 90, 100. You can lead a very healthy life. So even though you have the wrong genes, blame your parents. Sorry, I can't. But if you can actually take charge, you do not have to be dependent on doctors and hospitals for, kind of taking care of your health. So we're saying genomics is the answer. Use that learning and give a score which tells you this is what you should focus on. And this is where AI will become even more intelligent, because you're going to put more data to say exercise was the best thing for this gene type. Nutrition was the best thing for this particular gene type. I'm going to give that simulations over time when we have enough data. And that's the ultimate roadmap.
I think that completes the entire picture for that. Like the level 5 could be just completing the final process and the final offerings of the recommendations we can give to this individual, catered to that personal needs.
Absolutely. And I can just tell you one last thing here.
Yeah.
Stress is the biggest cause of all this. Forget genes. Just manage your stress. Just be relaxed. Don't worry too much. I'm sure things will sort themselves out. Don't be too worried.
I think when we join MBA, I think this would also be the narrative when you join IMB, that stress will become your second nature eventually when you come out of it. And it's good to see how we'll eventually come out of it. So for students here, so all of us are aspiring entrepreneurs building our own ventures and probably will join the official workforce within a year span of this. Any advice for someone who's building into the wellness sector? What things they should focus on day one to build a strong foundation in this?
So I would just say, firstly, you have to be passionate about this. Follow your heart. Very, very important. Don't do it because everybody else is doing it. Do not follow the herd mentality. Because I can tell you from my own experience, I am Bangalore. We had 3%, and this is true, by the way, worldwide. Yale, Stanford, so many studies have actually proven this. 3% students followed their heart and said, this is the sector, this is the company I wanted to join. They were lowest paying jobs, by the way, much lowest paying, because we had a quantum of 2 lakhs to 28 lakhs. I'm talking about 98. So that was the range. They chose jobs that they liked, they really loved. Cut over to 10 years, these guys were probably 10 times more successful than the average batch because they followed their heart. I'm just saying, do not worry about the herd mentality. Do not worry about it. Focus on what you feel is right and give your all to it. That's what I would advise.
Thank you, sir. I think this will resonate with us for a long, long time. That brings towards the end of the session. I don't want to take all the time and open it up to the audience if you have any questions.
So actually, I'm building in the healthcare space itself. So building Genome AI, which is genetic-based testing. So we want to focus on 2 to 3 preventive healthcare. Diabetes obviously is a very big market to begin with. Secondly, also prenatal fetus test, basically, right? So before the baby is born, I'm able to identify genetic issues. And the third one being, of course, weight loss, right? So very similar to what you talked about. But we are planning to build an ecosystem where if we're able to get these tests done early at an affordable rate, around 6,000 to 7,000, that at least India one can typically afford. Can we biohack their lifestyle, provide them, nutraceuticals is also a big market. which will essentially help in the biohacking process.
Okay.
So my question to you is, sir, we've just started with the platform. Obviously, with that data, you can do a lot of things. You can do drug trials. You can, team up with pharma companies to discover new drugs. What would your advice be to me in terms of how should I go about it? As you know, let's say step A.
So look, firstly, let's talk. There's a very, very long discussion that needs to happen on this. I can't, kind of do it in a very small time frame, but I can tell you data is the key, right? How do you really get that data? And all advice I will just give you is don't cut corners. Don't do the shortcuts. India, we have this jugaad mentality. Let's not do the jugaad. Let's try and make sure that we follow the path of clinical trials. Do this well. The world is your playground. I'm just giving you a quick example. I used to be a jury member for NASSCOM and Tiki back in the day. And I was judging the best 10 startups in India. And I basically went to Bangalore and we were a jury of 5 and we selected 3 top startups. And there was one startup that said, I'm doing clinical grade testing for my biomedical device. And I brought them up to the top 3 because I said they've done clinical grade testing, which is incredible. So don't push them out, make them part of the top 3. And the jury members fortunately listened to me and got it up. Long story short, chairman came to me later and said, look, why did you bring them up? And I said, look, they're clinical grade testing. This is lying. They're lying. We've tested them. I can tell you the opportunity that they had if they had done that testing properly. If they had focused on quality, not quantity, that quality would have taken them places. I would have taken them places. Unfortunately, they lost out. So to me, you can bullshit whatever you want, but ultimately it's about the quality that matters. You got to really, really focus on perfecting this because this is the future. So just be at it, have the patience, and follow your heart.
Absolutely. So I think, like you mentioned, pharmacogenomics was very important. So currently, a possible that we're planning is get the 150 FDA drugs which are approved, and based on those genetic markers, focus more on precision medicine. That, let's say, very simple examples, right? Like Dolo may not work well for me. There may be some other medicine out there, right?
Let's talk. I'm just saying because I know, but very, very interesting area. Very happy to discuss.
Amu.
So, 2 quick questions. One, keeping double click on how you decided on corporate couples and what was that given. And the second is that in the healthcare market, wearables is becoming very, very big. And Apple has a very big vision for it. So how we see that coming into your...
Sure. No, great questions. Look, corporate wellness, I just mentioned because we feel it's, you can get more volumes for less cost because it's too costly otherwise B2C market in general. But to your second question, wearables is absolutely going to become even bigger as we go forward. But today we're not being fully validated. So what we are trying to do is currently I'm just getting data from the devices, from the Apple phones and the Androids and all that. So I don't have to worry about which wearables is giving the data because it's all coming in a phone. But once we realize this IoT device is now tested, accurate, validated, we will integrate. We have a very open architecture. So API integration can just be done with any of those individual wearable devices. You can keep on adding and enhancing. There are some very interesting tools that also measure sleep. I will add that sleep parameters into this. Sleep, by the way, is extremely important. I'm just giving a sense to all of you. We pride ourselves on being, very, very gung-ho and very agile and active without sleep. I'm sorry, guys. Please sleep 7-8 hours. But I'm telling you, frankly, wearables is important, but let's not jump the gun until we get the validation, until we get the results to come in.
Eventually, will you see yourself getting into the hardware business as a profit?
Not me. We will have partners. I believe there's enough space for everybody. You want it to be an ecosystem, people contributing and benefiting, and you want an Uber feedback model. So the market sorts itself out. Wherever you see that this is a great device, great IoT device, you will have more and more people adopting it. So for me, it's all about data, all about user feedback. And we grow this together. That's the intention.
So I wanted to understand a little bit more about the user sentiment that you have, Paru. So I think one of the lines that you said is we have sick care, not healthcare. And I think that really stuck me because I think a lot of us around here as well have this mentality now that we don't want to go to a doctor because they tell us something's wrong with us and we are too afraid to do this. So what I do observe that the sentiment in the market really picking this up.
So look, the sentiment is quite positive. People, again, they don't trust this very much. That's one problem which we have to solve, which is why we're getting hospital as partners. And of course, our objective is to do this and show them the proof. It is not swimming with the current. We're swimming against the current, but this is where ultimately the river is going to change. I'm telling you now, it is going to happen in the next 5-10 years because healthcare costs cannot sustain the way they are today. Now, I can tell you the problem which we have in hospitals today. When you basically have a HbA1c of say 7.5 and 8, that's when hospitals get interested. That's when doctors get interested. They're not telling you when you're at 5.7, when you're at 6. This is where the prevention can happen. Nobody's telling you. They get the reports and they tell you you're fine. This is the stage when you can correct. You can change some lifestyle condition and get you back into normalcy, complete normalcy. Unfortunately, we are only looking at acute conditions, which is where it's too late. You can do anything after this. You get to a type 1 diabetes, you can do nothing. And it's a silent killer. Literally. So I can tell you, the sentiment is everybody wants wellness, but they don't trust it. We have to build that trust step by step. And that's where we need the youth to be involved. We need fresh ideas. And we want people to say, look, this is working. Because one customer will bring in 12 more customers. Because I'm going to give them proof this worked for you. It can work for you as well. So we want to build credibility step by step. And I can tell you, it is the future. There is no doubt. You have to move towards preventive care. You have to move towards continuity of care, which is not happening today. You solve one problem, but you've not addressed the root cause. You've addressed the symptom. You don't know what the root cause was. And that is what you should be addressing. And you have pillars already. You have these you have all these tools in your arsenal. I can tell you, we get completely at a loss when you go to a hospital. You go with the loved ones. You go with your dad, you go with your mom, you go with your, loved one, and you see that you do not know what's going on. It's a black box. What's happening there? The doctor doesn't have time to tell you what's happened. We want this to be taken up, the charge, the control to be with you. You should be the pilot of your life, not the doctor, not the hospital. They don't have time. They are looking at too many cases. And I'm not blaming them. I'm just saying you don't have time. So you have to become the pilot of your life. And you can do this with data. So we want to give you the tools to make you the pilot.
Do we have any more questions?
So I had a question. You mentioned connecting a lot of data and providing it to the customers. So do you think that the customers would be overwhelmed by seeing the data in the first place? There would be a lot of information that they will be that they have to go through.
No, great question. So we are basically doing it only in 3-4 panels. So I'm trying to simplify this for them. Our tagline is simplifying wellness. What we're basically doing is we're saying we're giving you a cardiac health panel, we're giving you a metabolic health panel, we're giving you a diabetes health panel, and we're giving you a body composition analysis. So I can tell you, today you look at weight, everybody says, I want to lose weight. Not the answer. We're giving you actually scientifically curated parameters and panels, 3-4 panels. So if you're basically, let's say, improving in this panel, and I have my algorithms, my AI running on these panels. So I'll tell you, this is what has improved. And we will get this further validated. I'm already at about 80-85% accuracy. I will get better with time. So for me, I'm making it very simple for a user. I'm going to reduce your risk profile for cardiac. And these are parameters that are really, really well researched. I've spent 6 months researching these panels. I spent 2.5 years in this venture. So objective is to try and make this much more simpler for the user. And all you need to do is, have you improved in this panel? Have you reduced your cardiac risk? Have you reduced your diabetes risk? And like I said, you can actually stop these genes also from expressing themselves if you just use normal hacks. Just exercise, just walk, just sleep right, just stress less, and eat right also.
So that brings us to the end of the discussion. So it was really, really inspiring to hear about your journey and get the depth of wellness sector currently in India and the disruption that is available outside as well. We hope we join the corporate workforce soon and get first-hand experience of Prana Health. Hope the company has it still. Thank you so much for joining us today here.
Well, thank you. And now we can join Prana Wellness also, as interns and as possible partners. So I'm saying you guys are entrepreneurs. So don't worry about joining only corporates. You will create your own companies. You'll all create, amazing multi-million-dollar businesses. So don't worry about only corporate jobs. That's all I would say.
Thank you so much.
Thank you.